back to my channel. Today I am going to talk about cyanosis. What is cyanosis? The first thing, cyanosis is bluish discoloration of the skin and mucous membrane. So why there is a bluish discoloration? It is because of the reduced amount of hemoglobin. So how much reduced it will be? It will be more than 5 grams per 100 cc of blood. Clinically you can diagnose until it is less than 85%. When the oxygen saturation is below 85%, then only clinically diagnosis is possible. Now coming to the types of cyanosis. There are two types of cyanosis. First is peripheral, another is central. So what is peripheral cyanosis? Peripheral cyanosis is presence of normal arterial oxygen tension, O2 saturations is normal, but there is cyanosis because of vasoconstriction. This vasoconstriction is peripheral and it lead to low cardiac output. When the cardiac output is low, the circulation to the periphery is also reduced. Hence, it causes sluggish peripheral circulation, and this ultimately lead to your peripheral cyanosis. Now coming to the common site where you can find out peripheral cyanosis. The first one is the tip of the nose. In this tip of the nose you will get peripheral cyanosis. Ear lobules you will find cyanosis. Ear lobules. Tip of fingers and toes and palm, and so these are the few common parts where you can have the sites where you can visibly see the peripheral cyanosis if present. Now coming to the causes. What are the causes of peripheral cyanosis? The first cause is related to the heart, that is cardiac output. This cardiac output can be reduced when there is left ventricular failure or acute left atrial failure. So these are two most cardiac causes which may cause peripheral stasis. Second one is shock. This shock can arise either from burn, severe burn, or hemorrhage. When the hemorrhage is severe, then exposure to cold. Exposure to cold can lead to peripheral cyanosis, as it can reduce the peripheral circulation. One important term is cryoglobulinemia. Cryoglobulinemia is when there is excessive low temperature, when there is exposure to cold. That low temperature may they form an abnormal plasma protein. So this abnormal plasma protein, this cryoglobulin can also be found in conditions like lymphoma, nephrosis, multiple myeloma, collagen diseases, and Kala Azar. So these are few important condition where cryoglobulinemia can be seen. In case of cryoglobulinemia, there will be peripheral cyanosis. Now coming to Raynaud's phenomena. Have you heard of this term, Raynaud's phenomena? So Raynaud's phenomena is also characterized by bluish discoloration of the digits. When the finger digits, the terminal digits will give a bluish discoloration. This is because of the excessive vasoconstriction response to either cold or any other mechanical stimuli. Apart from this, various other any other cause which is causing venous obstruction. Suppose a patient is having a tourniquet for a longer duration, it may lead to vasomotor disturbance and may give rise to cyanosis due to local effect. That will be a local, in the area where there is that obstruction is there, in that area only you will get that cyanosis. So this was about peripheral cyanosis. Next we will talk about central cyanosis.